You might already know that heart disease is the #1 killer of both men and women. And you might also know the typical healthy heart advice. Eat a healthy diet, such as the Mediterranean diet, exercise for at least 150 minutes weekly, and don't smoke. This is well-known and well-publicized lifestyle advice that can significantly reduce your risk of heart disease. But is that the whole story? Actually, it's not. How you think, feel, and process stress can make a difference too. A truly holistic view of heart health cannot neglect emotional health. The link between heart and the emotions is more than metaphorical. People experiencing stress, anxiety, depression, and even PTSD over a long period of time may experience certain physiologic effects on the body that can impact heart health. Examples include things like increased heart rate and blood pressure, reduced blood flow to the heart, and heightened levels of cortisol. Over time, these effects can lead to calcium buildup in the arteries, metabolic disease, and heart disease. A few studies have shown that people with depression have stickier platelets, which could make their blood more susceptible to clotting, contributing to heart disease risk. Treating the depression may reduce that stickiness, implying that the platelet changes were caused by the depression instead of the other way around. Furthermore, people who are depressed following a heart attack are less likely to recover well and more likely to have another heart attack. Isolation and loneliness and other emotions that seem to be particularly important to post-heart attack survival. One study out of Duke University reported that half of patients with heart disease who said they had no one to confide in died within 5 years of having a heart attack. Only 17% of patients who said they had someone supportive whom they could confide in died within those 5 years. Anxiety is another issue with well-demonstrated links to coronary heart disease, and people with anxiety disorders are less likely to recover from a heart attack successfully. Fortunately, emotions can positively influence the heart as well. Research shows a 22% lower heart disease risk in people with a positive outlook, and good stress management skills predicted lower death rates from heart attacks than smoking status. The lesson here is that you can't just eat well and exercise and assume your heart is okay if you're angry, unhappy, anxious, lonely, or chronically stressed. Your emotional life matters for heart health. Whether you take up meditation, start a yoga practice, nurture your personal relationships, or seek counseling to help process your feelings, you'll be helping your heart too.